overview of patterns. In 5 to 6 minutes, we'll see what this, we will have a bird's eye view of what is pattern strabismus. So you look at this definition, this word incompetence. Incompetence in squint, it means that if you look at the deviation of the angle of the squint, in various cases it will be different. That is what the word incompetence means. So if you look at the definition of pattern strabismus, it is a situation where there is a presence of significant deviation in the angle of the squint from up gaze to down gaze in patients who present to you with an ESO or exotropia. Or this may also happen in a situation where in the primary position, apparently there is no squint in the primary position, there is no horizontal squint, but in up gaze or down gaze, there may be a significant incompetence. So this is the situation, or what is pattern strabismus. So when do you, in a strabismology clinic if you are sitting, or in the general ophthalmology clinic if you are sitting, when do you suspect a pattern strabismus? So any patient presenting with an ESO or exotropia, if he or she has a chin up or down position, or as I said in the definition, in the primary position there is no, if you see the patient, there is no obvious squinting, but the patient has got a chin up or down position, you suspect that the patient may be having a pattern strabismus. So if you look at the incidence of alphabet pattern, so this is alphabet strabismus, pattern strabismus, where pattern would be the more ideal term, because you may rarely have pattern strabismus which may not follow the alphabets. So the pattern strabismus would be the more ideal term. And if you look at the incidence of pattern strabismus, the alphabet pattern strabismus is seen more in esotropias than exotropias. And amongst the common alphabet patterns that we see between the V pattern and A pattern is more than, V pattern is more than A pattern. So other than the common V pattern and A patterns that we see, rarely you may see a Y pattern, which is probably a subtype of V pattern, where there is a relative divergence which is more in the up gaze. Or you may get an inverted Y pattern or an lambda pattern, which you may consider as a subtype of A pattern, where there is a relative divergence more in down gaze. Or you may also get rarer X patterns, where there is a relative divergence both in up gaze as well as in down gaze. Or a pattern like this, which is called a diamond pattern, where there is a relative convergence more in up gaze as well as in down gaze. So the various patterns can be there. So there are still rarer other patterns and pseudo patterns. So these are the usual alphabet patterns that we come across. So if you, in alphabet patterns, in pattern strabismus, if you look at the associated features, some patients with V or Y pattern have an inferior oblique overaction, and patients with an A pattern or the inverted Y or lambda pattern may have an superior oblique overaction, or patients with the rare X pattern may have an overaction of both the superior oblique and inferior oblique. So in cases of pattern strabismus, many a time we find that the obliques may be at fault or the causative factor, but it need not be always. Patients with no oblique overaction with pattern strabismus may also can have this pattern strabismus, where the horizontal or vertical recti even may be the causative factor. So which may be due to anatomical alterations in their insertions of the recti. So this is another postulation. Demer et al. Demonstrated that there are compliant pulleys of collagen and elastin around each rectus muscle at the equator. And these compliant pulleys, they act as the functional origin of the muscles, and an ectopia of this pulley at the equator of the recti muscles. Because of the ectopia, that could be the reason for the pattern strabismus. And another thing we may say is, patients who present with V pattern esotropia, they tend to have their lateral canthi higher than the medial, which we call as the mongoloid facies. Whereas in V pattern esotropia, they tend to have their lower canthi lower than the medial. That's the anti-mongoloid facies. That's another thing which you may come across. And the most important thing in pattern strabismus, because when you start the treatment planning, evaluation, it's in any squint, for any case for that matter, evaluation is important, but it is more so because unless you have a definite idea of what is happening to the extraocular muscles, you cannot plan the treatment. So the patient should be evaluated for pattern strabismus in all the 9 directions of gaze using prisms and alt cover test with distance fixation at chin elevated 30 degree, depressed 30 degree, and in primary position. And more on the clinical features, evaluations will be dealt with by subsequent speakers. Thank you.